welcome. You're watching Beat Diabetes Myths and Facts. I'm Rishika Barwa. The COVID-19 pandemic has shaken up the world in more ways than one. While COVID has given rise to new challenges and uncertainties, the pandemic has also yielded some valuable lessons. What we eat, our exercise habits and general hand-washing hygiene awareness have garnered greater focus. While dealing with COVID, we overlooked the fact that people's lifestyles were severely disrupted. As a result, metabolic problems have become more common. Unhealthy eating habits, lack of physical activity and mental toll of the quarantine and isolation and even the fear of contracting COVID in healthcare settings have all adversely impacted people, especially those with diabetes and heart diseases. A multi-sectoral approach to promoting healthier diets and increasing physical activity can help in slowing down the diabetes epidemic and heart diseases. Beat Diabetes Myths and Facts will impact and help a large number of people to prevent or control metabolic disorders. Today we have with us a panel of experts to share their advice on how you can lead a better, healthy life. Dr. Jayant Kelwade, MBBS, MD Medicine, DNB Endocrinology, Consultant Endocrinologist, Alexis Hospital, Nagpur joins us. Dr. Thillai Vallal, MBBS, MD, DM, FCCAI, Senior Consultant, Interventional Cardiologist, Venkateshwara Hospital joins us from Chennai. Thank you, doctors, very much for sparing your time and being with us. Dr. Jayant, if I can begin by asking you, we all know that exercise or any physical activity for that matter is very important for our well-being. How does exercise indeed help to manage type 2 diabetes?
Yes, exercise form very important role in management of diabetes. Exercise helps to improve insulin sensitivity significantly and is bring down the insulin resistance to a significant extent, and that ultimately leads to the better glycemic control. Not only that, many times the need of oral hypoglycemic agents and insulin significantly reduce to regular exercises. Not only this, other parameters like doing regular exercises, control blood pressure. It also helps to improve the dyslipidemia, cardiorespiratory strength, and ultimately that reflect into the better cardiac condition in our patients, and the cardiac complications or cardiac mortality significantly come down if patient do exercises. Again, and the body composition, body fat significantly reduces, lean body mass improves, and that again helps to improve the insulin sensitivity. Not only that, the generalized well-being and the psychological health significantly improves as exercise leads to increase in endorphins, which are considered as happy hormones. So in overall, doing regular exercises lead to the significant improvement in the health of diabetic patients.
Right. Dr. Thillai, it is well known that exercise can also reduce the risk of cardiovascular disease and improve overall health. But what types of exercise are appropriate for people, and patients specifically who are at a risk of cardiovascular disease? Are there certain types of exercise that they should and should not do?
We can classify the patients into three categories: no risk people or low risk people, moderate risk patients and high risk patients. For example, a normal, no blood pressure, no sugar, no cholesterol, no obesity, healthy, normal young individual, they can have a normal activity. They can have a brisk walking, slow jogging, even fast jogging, and regular exercises they can do. Isotonic mainly, 2 times a week they can do isometric exercise also. For people having a moderate risk, for example, having high blood pressure or high diabetes or obesity or their other comorbidities, they can have a control of the blood pressure and then go for the exercises. For example, blood pressure less than 150/90, they can do the exercises, regular exercises. If it's above 150/90, they should control the blood pressure before doing the exercises. Third category of people with a high risk patients or high risk category, they are diagnosed to have a heart disease, cardiovascular disease with a treadmill test, or they are already undergone angioplasty, or already undergone a bypass surgery, or past history of heart attack, Those patients, the risk stratification to be done by the family doctor by assessing their heart condition, overall pumping efficiency, and overall the physical capacity or lung capacity. Then it should be customized as per the doctor's advice to do the exercises.
Right. Dr. Jayant, what exercises should be avoided for diabetes patients, and what type of exercise are safe for diabetes patients?
If the patient is very young, he is having just mild diabetes, well-controlled sugars, and no complications, so there is no restriction for any exercises.
Right.
But if, on the other hand, if the patient is having comorbidities, cardiac conditions, and the sugars are not well controlled, in that case, yes, the exercise program should be medically supervised. Let's take an example. If the patient is suffering from peripheral neuropathy where the sensations of limbs are significantly decreased, so in that category of patient, doing repetitive exercises or weight bearing exercises may cause trauma to their limbs, and that diabetic foot ulcer, and they may land into the complications. If the patient having autonomic neuropathy where there is a sensation of cold and cold sensation has significantly reduces, in those category of patient, they should avoid doing exercises in a very extreme hot or cold environment. Also, if the patient is having retinopathy, underlying retinopathy, they should avoid the exercises which can increase the intra-abdominal pressure like Valsalva maneuver, and they should prevent excessive head movement as well. It is, if you ask me what is the best exercise for diabetes, I will say the exercise which the patient can stick to, and for that I can say the walking is considered as the best exercise because it is safe and easy for any patients. So walking is considered as one of the best exercise for diabetic patient.
Right. Dr. Thillai, how much exercise is recommended for people with, sort of different categories of heart diseases? What would you suggest?
Very interesting question. That even a slow walking itself is advantageous even post heart attack. After the even heart attack, after 24 hours, we make the patient to sit on the chair and make them walk inside the room. So mobility is very important. It all depends on the number of days after the heart attack and also number of the ejection pumping efficiency of the heart. We have to advise them accordingly. Even cyclist mobility is sufficient, but at the end of discharge, for the 5th day or 7th day, when we discharge the patient, we recommend them to walk for 5 minutes morning, afternoon and evening before taking food. So mobility is very important. But generally it takes about 6 weeks time post heart attack to recover back to normal stage to go for regular walk outside. For example, we generally recommend 150 minutes of walk per week. That is 30 minutes of walk per day for at least 5 days a week. More is better. For example, minimum is 150 minutes per week, but 300 minutes per week is our aim. If the normal pumping efficiency of the heart permits the patient to go for more walking, then we recommend them to walk 300 minutes per week to be achieved.
Right. Very interesting. Dr. Jayant, also when it comes to diabetes and exercises, timing is really everything. What should you eat before? What should be the total duration of your activity? What time of day should you do it? What are the precautions that people with diabetes need to take before exercising? Is it necessary perhaps to check your blood glucose before you begin your exercise schedule?
Yes, definitely, because doing exercises can reduce the blood sugar level to significant extent, and patient may land into the hypoglycemia. And that's why avoid this, to avoid them to land up into the complication, they should check blood sugar before doing any exercises. And if the blood sugars are below 100, they should have some snacks where you can say a small around 15 to 30 grams of rapidly absorbing carbohydrates they can take before starting off exercises. And if they are planning for vigorous exercises, at least 30 grams of carbohydrate should be taken before starting any exercise. Another important thing, they should have their sufficient amount of water or snacks and their glucometer handy when they are doing exercises. Important thing is they should do exercises in presence of any family member or friend, because in case of any emergency they will help to assist them. So these are certain precautions every diabetic patient should follow while following any exercise program.
Right, I think that's very important, especially the contingency contact numbers, etc. Are important also to keep in mind just as an extra safety measure. Important advice there coming in from Dr. Jayant. On that note, we're going to slip into a very short break. We'll be back with a lot more. Stay with us. Welcome back. We have a panel of expert doctors helping us navigate through diabetes and heart troubles. Dr. Thillai, what exercises, should be followed by people who have undergone an angioplasty or a bypass surgery? What are the do's and don'ts when it comes to such patients?
Okay. For patients who have had a heart attack and they have undergone angioplasty or bypass surgery, they should follow the rehabilitation program. That is custom made. It all depends on the severity of the blockage and severity of the damage already done by the previous heart attack or the procedure done. For example, is a surgery, angioplasty with 1 stent or 3 stents or 4 stents or bypass surgery. Every patient is different in the recovery phase. For example, a non-diabetic can recover faster. If you're diabetic, it may take a little longer time. So it's a custom made rehabilitation program we have for every patient following a heart attack or even stroke. It takes generally about 4 to 6 weeks time to get stabilized. For people without any heart attack or any stroke, post angioplasty, we can mobilize them in 24 hours time inside the room. 5 minutes they can walk inside the room next day itself after the angioplasty, and we discharge them after 72 hours time. When they get discharged after 72 hours time, we ask them to do the same type of few minutes walk inside the house for few more days, 2-3 more days. In a week's time, they are fit to walk outside the house to the park or beach or outside. They can start the walk post angioplasty 1 week time. Similarly, for bypass surgeries, after the 6 weeks of rehabilitation program is over, they can go for the walk in the park regularly. We recommend to walk minimum 30 minutes a day and maximum 1 hour a day.
Dr. Jayant, can you guide people who are on insulin? What exercise regimen should be followed? What precautions related to dosing, for instance, should be taken for patients who are on insulin?
So this is very important question, because those patients who are on insulin, they are again at very high risk of developing hypoglycemias. So the patient, if on insulin and if he wants to join any exercise program, is always medically supervised. You should consult your doctor before, because you may need to adjust the insulin. So always, if the fasting blood sugar is coming down very low, then you have to reduce the doses of nighttime basal insulin. If you want to do exercises after taking insulin shots, you should avoid vigorous exercise for at least 1.5 to 2 hours. And as already I have mentioned that you should have some snacks with you, your supportive medication, supportive stuff should be there. So a lot of precautions need to be taken by those patients who are on insulin.
All right, I think that's very important for insulin patients to actually understand. Dr. Thillai, during the pandemic, people have got more occupied and busy, with work. People hardly get any time to exercise. Also, work from home has led to a more sedentary lifestyle. What are the easy exercises that you would suggest for them?
There are 3 different types of exercises we recommend. Number 1, once they are able to climb the terrace, they can walk in the terrace. The exposure to sunlight is helpful for them to get vitamin D as well as free good air, as well as improves their mind capacity also. So walking in the terrace is first thing recommended. Otherwise, walking outside the house, near the home they can walk. Suppose it is not possible to go to the terrace or not possible to go outside the house, then we recommend them to have a slow walking inside the house around the dining table or the sofa. We ask them to put a figure of 8 figure of weight. Ayurveda recommends figure of weight also. We make them walk around the dining table and sofa so that they can walk for 20 to 30 minutes inside the house itself. For high intensity exercises, they can do jogging or slow running in front of the TV for 20 minutes to 30 minutes. What TV watching time is quite significant. At least 30 minutes they can jog or brisk walk in front of the slow jogging they can do in front of the TV when they watch the TV. These three things we recommend for people who are staying indoors.
All right, so if you are indoors, it's no excuse to not exercise. Those are some of the tips that you can actually follow. Dr. Jayant, we've discussed the benefits of exercise for people who have diabetes. The question that many actually have is, can a regular exercise regimen, reverse diabetes? Does that also happen?
Yeah, again, interesting question, because many patients want to rid of this diabetes. But if the patient having diabetes for long duration, say 5 years or 10 years, it will not be possible to reverse the diabetes in that case. But if a young patient newly diagnosed with diabetes, he has various comorbidities like his obesity, insulin resistance, in that category, significant reduction in blood body weight by doing exercises, following strict diet regimen can leads to reversal of diabetes in those patients. But if you ask me, for a long-standing diabetic patient, it is not possible.
All right, I think that's an important clarification there as well, but regular exercise does have indeed many benefits. Dr. Thillai, what about the risk of heart attack during physical activity? This has been a huge cause of concern, during the course of the pandemic as well. Can the risk of a heart attack actually increase because of intense physical activity?
As a cardiologist, we used to tell proudly, heart attack is one of the most predictable and preventable diseases among all the lifestyle diseases. So we are confident to assess the patient, to predict the problems. Generally, they are not sudden. So anybody who is willing to go for intensive exercises need to have a cardiac evaluation, because for example, athletes dying on a heavy exercise or either having hypertrophic cardiomyopathy, it is a genetic disorder that can be easily identified by a simple ECG and echocardiogram. Similarly, people having a silent heart disease, even high blood pressure is a silent killer. 60% to 70% of the patients with high blood pressure may not have any symptom. So even obesity, other related respiratory issues ought to be evaluated properly. So our recommendation is, if you go for high intensity exercises like athletic training or heavy intensive exercises, they need a once evaluation with the ECG and echo and lung capacity to help us to avoid sudden death. Suppose if we identify the patient who has high blood pressure or having ECG changes or treadmill positivity, they are not recommended to do the high intensity exercises. They get to have a rehabilitation program, and slow graded exercises they are recommended.
Right. And what about heart patients? Can they indulge in any kind of high intensity exercises, or it's not recommended?
They can do after the rehabilitation and complete evaluation by the cardiologist with the echocardiogram and treadmill test. Echo revealed a normal pumping efficiency of the heart, and treadmill is negative even after 12 to 13 minutes. Then you are fit for high intensity exercises. We can do that. But the word of caution, the recommendation is, we are used to tell, sitting is the new smoking. Sitting should be avoided. Most of the people sit for 6 to 8 hours a day. Sitting 8 hours itself is like smoking one packet of cigarette a day. So mobility is very important.
I think that's very important advice. Also, like you said, there has to be a balance between high intensity exercises and just sitting around and doing nothing. Sitting is the new smoking, like Dr. Thillai has pointed out. Thank you both very much for sparing your time and being with us. That's all the time we have. Short break here. News and updates continue.